All righty, let's see if we can get this show on the road. Hey, everyone. Hope you're having a fabulous day today. Thank you so much for taking the time to join us. Today, we'll be talking about multiple choice question strategies and how to rock it on exam day. I hope that we are able to answer some of your questions. And I've also got some practice questions for you as we get closer to the end today. So if you don't mind, as we get tuned in, would you mind head over to that chat box? Be sure it's broadcasting out to all panelists and attendees. Got to get my tongue working for today. All panelists and attendees, and let me know if you can see and hear me okay. Always good to have a good sound and video check. Awesome. Fabulous. Okay, so today, our whole goal, we're going to talk about how to prepare for multiple choice questions. Multiple choice questions. So this is maybe one of the most important things to do when you are preparing for the exam is to understand how they're going to be asking questions. Let's see, I just shared the slides in the chat box there. So if you don't mind, we'll share that a time or two, make sure everyone's got access to the slides as we begin. And yeah, sorry, just getting things ready to rock and roll. Yeah, so today we'll be talking about multiple choice question strategies, and then we'll go through some practice questions together to make sure that we are solid, not just on the content, but also how to read a practice question and apply the things that we'll be talking about today. So awesome, fabulous. Let us go ahead and begin with all this. So we're going to be talking about practice questions and question strategies today. So multiple choice questions, as you know, on exam day, you can expect to see multiple choice questions as the format for the exam, meaning there will be a stem listing the pertinent content for the question. There will be the actual question itself, or the actual stem that asks which of the following blank is the most correct or would be most effective or would be the most appropriate next step. Finally, we go on and see the options, and your goal is to read through all the options. So with that as the context, here are some of the tips that I want to give you to help you identify what to do on a question. So Rosa asking a very good question. Just out of curiosity, how long will this session go? I think we'll go for about an hour, so about 60 minutes. I don't think we'll go too much longer than 60 minutes. I guess it just depends on the questions that come up. So step number one is maybe the first and foremost step, which is to begin with a positive mental attitude. So easier said than done, right? To get into, and just think about it when you're on the test. There's nothing that's so self-defeating as having a negative attitude. Rather, when you get into the test, make sure you have a positive attitude, or as positive as possible. And so there is a strong correlation with the way that we hold ourselves, the way that our body language is, and how we perform on tests. And so one of the biggest pieces of advice I have for you on test day is make sure that your body language reflects the confidence that you should feel. Even if you don't feel the confidence, see if you can reflect that confidence. So for instance, having your shoulders square, sitting upright, and being in an engaged posture as compared to the sacral sitting slouched posture, you'll find that your focus is increased and your confidence is increased. Let's see, Andy asking over there, anyone needs a study buddy? I speak English and Spanish. Ooh, nice, nice. I know we have a few Spanish speakers here today. We always get a few in each of our live classes. So for sure, Spanish speaking, and there are always a few out there who can speak Spanish and English. So awesome. So multiple choice questions, talking about having a good positive attitude and using your body language to reflect that. So that's fabulous. Good way to start, good positive attitude. Okay, so step number two. This is the Will Crane method for reading questions. So I know that there are some, and I'll talk about some instances coming up about reading questions in a slightly different way. But as far as reading the questions, generally, you read the question. And this is my suggestion. Number one is you read the question first, just to get the idea of what it's even talking about. We'll call this the 10,000-foot view. Meaning that when you look at the question, you could say to yourself, okay, this question is asking about the parathyroid hormone, or this question is trying to decide if I know what to do with aquatic exercise. So get an idea for what the question is looking for. Second time you read through the words, make sure that you're finding the key information. You'll see the age of the patient, perhaps the onset of symptoms, the alleviating factors of symptoms, all that. You're going to look for that key information. And all of that information, that's what's going to give you the key to answering that question. So you have an idea of what it's asking. You're able to then identify the specifics of the question. And then finally, you read that final sentence, the actual stem that says, which of the following would be most or best, least or worst. Typically, the key modifying word is capitalized and bolded, so best or worst or most. Finally, this is a very important step, is to formulate in your mind what the answer would look like. So either the characteristics of the answer, try to say to yourself, okay, this question is asking about aquatic therapy, asking about buoyancy if it's at chest level. And you're supposed to identify in your mind, say, okay, chest level is about 75%, or what is it, 25% weight bearing if it's all the way up here your neck. So try to identify what the characteristics would be of the correct answer for the question. And then you'll look for the answer options to find that answer. So typically you read number one, you look through it and either eliminate it with a rationale or identify it as the correct answer, but then look through the other ones as well. So you look through each of the options, trying to either rule it in or rule it out based on the content that was given to you in the question. So some people choose to use a mental checklist or a checklist. Think about it in terms of if you're trying to decide between two factors or two, let's say we're doing differential diagnosis and we're talking about a rotator cuff tear versus subacromial bursitis, subacromial impingement syndrome. So if we have subacromial impingement syndrome versus rotator cuff tear, you would look at the symptoms that are presented. Let's say they both have shoulder pain. So shoulder pain. Let's say they both have shoulder pain, but weakness, significant weakness is only manifest with rotator cuff or with rotator cuff tears. And so even though you can say, okay, well, part of the question would be correct for subacromial impingement syndrome, rotator cuff tear would explain more of these symptoms. And so you create this checklist, kind of a winner and loser list as you look through and try to decide what's going on. And so, for instance, if they list 3 symptoms of a condition, make sure you look and identify the condition that has all of those symptoms, not just part of it. So that's for differential diagnosis. And you're just comparing and contrasting options, trying to find the one that best fits the material or best fits the question. So that's number 2, is make a mental checklist. All right, so let's say you don't know the answer. If you don't know the answer, and I'll talk a little bit more about this on the next slide as well, but remember, there is no penalty for guessing. So don't get stressed out that you're going to lose. I mean, you're not going to gain the points for that question if you don't get it right. However, there's no penalty for guessing, so you're not going to get any sort of penalty if you don't know the answer to it. So bring your anxiety levels down a notch or two and just recognize, okay, maybe I don't know the exact answer to this, but I bet I can look at it and get at least some idea or maybe a guess. And so this is where, and I talk about this story. This happened to me just a month or 2 ago. I was rummaging through some old stuff, trying to clean out a drawer or whatever. And I found the old combination lock that I used for my middle school locker. And I had the combination lock in my hand. And if you would have asked me the day before what the combination to my lock was, I wouldn't have been able to tell you. I mean, I couldn't have remembered that. But when I held the lock in my hand, just the image of it, the weight of it sitting in my hand, I immediately dialed the 3 numbers in order to open up my old combination lock. It's the same thing that happens with our subconscious, that even if we couldn't articulate the exact answer, a lot of times we can at least identify the characteristics or have a feeling about an option. So this would be in a case where you know something about it, like you've been exposed to the content at some point. If you look at it, go with your gut feeling. So this is that very nebulous gut feeling. How do you feel about this question? Which one would you consider? Which one looks the best, even if you couldn't identify exactly why one is correct and one is not correct? All right, let's see. Just trying to get the slides out. Dropbox isn't working for me. Let me try one more time. Otherwise, I may have to post this afterward as well. Those of you who are part of the class, you'll get full access to all this as well. All right, so we'll try that one more time. Yeah, any questions so far about what we've been talking about? Any questions or concerns? Make sure that we answer them as we go. Okay, so as always, make your best guess, even if you don't 100%, if you can't 100% identify the content. All right, so let's talk about what to do in the case that you have no idea what the question is even talking about. You're really concerned about getting this question right. So let's talk about some things that you could do. So if you have no idea what the answer is, first step is to identify what body system is being tested. You could at least do that and say, okay, this is clearly a musculoskeletal type question, or this is let's say that it's a neuro question or a cardio question. What body system is being tested here? Then identify what stage of rehab. Are they asking an interventions question, differential diagnosis, examination? I like to tell people to pay attention to the longest option, or the option that has the most words, not necessarily because more wording makes it right. However, usually there's more details packed into a lengthier option, and they try not to write them this way, but at least pay attention for a longer option or an option that looks different than the other options. If there are any outliers, be sure to eliminate them. Like I was reading a practice question today about what would be the next modification for someone who had weakness. I can't remember exactly what it was talking about, but the next modification was encourage the patient to take steps 2 at a time, to go up and down stairs 2 at a time. Like, I think that's an outlier. Like, I can't think of a time when we've ever, other than maybe athletes, when I've ever encouraged someone with weakness to take the steps 2 at a time. So I could eliminate that one as an outlier almost immediately. And then the other thing you can do is look for options that are extremely similar. So for instance, if one of the options was, let's say they have decreased bone mineral density, and one of the options is that they have vertebral fractures, and one of them is they develop stress fractures. You're like, okay, those are very, very similar to one another. And usually if two things are similar or the same, if they are the same, essentially the same, then you can eliminate those options. So look for either outliers or crossover or overlap between options. And usually you can eliminate those right away as well. So if you can narrow it down to 50-50, that dramatically improves your chances of answering the question correct, going to 50-50. All right. So then the next step is to don't skip steps. So this is one that they really love testing you on this. Like, let's say that you had a patient who came in and they had a rotator cuff repair operative note. They referred to you for a rotator cuff tear. What would be the most appropriate next step? And so that's what I ask you. So here, I'll give you my quiz question. So let's say you have a patient who comes into your clinic, and I'll look for your help in the chat box on this one. Let's say that you have a patient who comes in the clinic for rotator cuff tear, kind of an average rotator cuff repair surgery. They've got the sling, they've got the abduction pillow, they've got their operative note. What is the next thing you would do with this patient? What is the next thing you would do if this, let's say 73-year-old male comes in with a rotator cuff repair, post-operative rotator cuff repair? What's the next thing you'd do? What would you do next for a patient that came in? For someone who comes in after rotator cuff repair, what is the next step? All right, so Rosa, Juan, exactly. Getting a detailed history and interviewing the patient. So you're going to start with your detailed history. And obviously I've got it written here, but let's say the guy comes in, you start with your detailed history. Try to understand what his prior level of activity was. Try to understand what his unoperative or his uninvolved side, what its baseline of activity is. And that's the nice part about shoulders is very often you have a control that you can compare the operative side compared to the non-operative side. So get a good detailed history. I had one person who, when I asked this question, they said the very next step, you should ask for the patient's name. So that's really getting to the beginning. Start with the patient's name and then get a good detailed history. Because so often we want to skip straight to interventions. You don't do interventions until you've completed your exam. So here's another good example of this. So let's say that you have a patient who you've been treating for a while. They come in, and some of you have probably heard this example from me before. But let's say that they come in for routine treatment and they sit down in the chair as they're getting their blood pressure taken, and they describe to you, say, hey, Will, I've got some chest pain today. It's really an abnormal, unusual chest pain. And what would you do next? So I'm going to ask you that question. Let's say that you have a patient coming in for a routine visit. They sit in the chair as you're welcoming them and say, hey, it's so good to see you again. And they report that they're having some retrosternal chest pain. What would be the next step? What would you do next? So what would you do next? Right, so taking the vital signs would absolutely be high on the list. You'd want to see if they were in any sort of cardiac distress. I would also be curious to see what the aggravating factors were. So Caleb, exactly, asking more questions. Just like Rosa says, was there a position change? Did they just climb up the stairs? Is this stable angina that just came on that's precipitating a heart attack? Or is this a gastroesophageal reflux disease? Are they having some reflux or heartburn that's not cardiac related? So you'll ask the patient more questions before you call 911, because just imagine what that would look like. Like, okay, we're going to call 911 for this guy who just had a spicy taco or something. So you talk to the patient. So Andy asks a good question. Does it happen often? Does it happen often? It happens enough that it's worth discussing for sure. I'm trying to think of when the latest example of this was. So like I had a patient, this was just 2 weeks ago. I had a patient that had just come home from the hospital and I was seeing him on a home health visit. So just imagine this. I was treating this gentleman on a home health visit after a knee replacement surgery, total knee replacement. This guy's an otherwise healthy, active individual. And I get to the house and the guy is acting funny. And so when I just say funny, he was acting like he was drunk, like he was severely inebriated. And I get talking to him and he said, oh yeah, my pain is terrible, but I took my pain meds. It's feeling a little bit better, but man, I just can't control it. And he almost started singing to me. I mean, he was really out of it. And so I asked him about everything that I could. And I actually got on the phone. I called the nurse and said, hey, I'm concerned about his mental status. Something seems to be off. And we ended up calling 911 and having the guy transported because he had taken his whole bottle of pills. And this is the bad part about opioids, is that he popped a couple of opioids and then he forgot that he'd already taken his opioids. And so he popped some more and he ended up taking the whole bottle trying to calm his pain. So all that to say that, yes, we talk with our patients about their history, trying to find out what's going on, specifically if it's something that is of concern or if it's something that's not of concern. Let's see. Andy, does it happen often? No, I meant to ask the questions. Does it happen often or just the one? I meant to ask the question. Does it happen? One. Yeah. So I like to ask questions while we're doing the class for sure. And I also like to ask patients these questions as we go through. Anyway, bottom line is don't get tricked. So for instance, the rotator cuff example, a good example, rotator cuff, first thing you do is you do your exam first, do your full examination before you move on to your intervention. So these are the questions where you'll get super frustrated because you'll see that one of the options, let's say we had our rotator cuff example. Let's say you have our rotator cuff example. One of the options on the test would be something like initiate Codman pendulum exercises. And this would be very frustrating because you'd look at that and you'd say, okay, Codman pendulum, that's a correct intervention. I would absolutely do pendulum exercises, but you haven't completed the exam yet. So don't skip steps. Stick with the step you're on before moving on. All right, so this is one that, again, so very easy for me to say. Know the content. If you know the content, it makes it a lot easier to identify the correct answer. And that, I mean, for all the tips and tricks I give about identifying correct answers on a multiple choice type question, there's nothing that compensates for actually having a firm grasp of what's actually going on. And so do your very best to keep a good handle on the content. And when you do find a practice question that tricks you, or maybe you don't know the exact answer to, try to create a flashcard. Do something that takes that content and puts it into your own words so that you can remember it for the next time. All right, so a few final tips here before we get to our practice questions. I do have, let's see, I think I've got 3 practice questions for you today. All right, so miscellaneous tips. When it comes to critical reasoning, number 1, always put down your best guess. Before you move on to the next question, always put down a guess. Either try to put down the right answer, clearly, but never leave a question blank, because you never know if you'll have enough time to go back and read through that question. So while you're in the mess, looking at the question, even if it's total guess, put down an answer, mark an option. Another one is don't worry about answer patterns. If there are patterns, when they put the thing into the computer, it's totally randomized. So don't worry about if there's 3 A's in a row or 4 B's in a row. Doesn't matter, totally randomized. If you can eliminate 3, just go through process of elimination and say, that one looks bad, that one looks bad, and that one looks bad. That final option must be correct. And finally, and I don't have it listed on this one, but if the answer is partially incorrect, then it's totally incorrect. So if let's say there were 2 facts, and I've got a practice coming up that'll show this. If there are 2 facts contained in an option and one of the facts is incorrect, you can eliminate that fact. And finally, identify opposites in the options. That usually you can identify, A and B are opposite of C and D. So like white blood cell ranges, if one is, 0 to 4,000, one is 4,000 to 8,000, you can see how they're exclusive to one another. And like 0 to 4,000 white blood cells, that's just not normal. And so you would, depending on the question, you'd probably be able to eliminate that one. So look for those opposites, because usually you can eliminate 2 and you can narrow it down to 2 options. Nice. So what questions do you have? I know I've been talking here for about 25 minutes. What questions do you all have? While you're thinking about your questions, don't forget that we're starting up our PT and PTA crash courses for the January 2021 exam. And then the full live course, we're starting up on actually next week. And we'll be meeting 4 times a week. We'll do one-on-one power calls. So if you need a little extra help getting through the test, this is something that would be a really, really good fit. Plus, we've got partial scholarships available. If you have some sort of hardship or military, we can definitely help you out there. So let's see. Rosa asks, do you mean to focus on the opposites and eliminate the ones that aren't? Yeah. So Rosa, when you're looking at options, very often you'll see them listed in opposites. So like I've got an example of this coming up about, let's say, doing a posterior glide versus an anterior glide. If you know that it's not an anterior glide, you can eliminate anterior glide, then that leaves you with the ones that are posterior glide. So I guess what I'm saying is just look for opposites, because they're exclusive to one another. And if you can rule out part of them, then that leaves you with the other 2. So Nicole asks, how much is it and what days do we meet? So it's $9.97 and we meet 4 days a week on Monday, Wednesday, Thursday, and Saturday. Monday, Wednesday, and Thursdays are in the evening time. So we'll meet on those days at 5 p.m., same time as this, 5 p.m. Eastern time. And then on Saturdays, we'll meet at 9 a.m. Eastern and we'll do practice questions together. So it's a really good way to talk about practice questions, very similar to what we're about to do now. Let's see, Vanessa, can we have the link for this class, please? Yeah, I'll go ahead and pull it up while we're talking here. In fact, I've got to get another thing ready as we get going. Yeah, any other questions before we move on to, like I said, I've got some practice questions for you. So, well, let's see, I've got it. Hold on a sec. Gotta get my poll ready for you guys. Oh, and by the way, while I'm thinking about it, don't forget to check out our free podcast. Just go Google search the NPTE podcast. It's on Google Play, iTunes, and Spotify. Another good free way to study. Let's see. Aman, do we get a recorded version of today as well? Yeah, so I'll post the recorded version of today on our Facebook page as well as our YouTube page. So be sure to follow us on Facebook and YouTube. All right, let's see. A couple of questions out there. So if there are two options that are alike, or that if one of them is ask more questions versus taking vital signs, what would you choose? Ooh, good question. So it depends on how much information you have. So for instance, if someone is clearly having a heart attack, let's say they're having retrosternal chest pain, radiating left jaw and arm pain, severe dyspnea, a history of a heart attack, let's say they have pretty much every factor there is, you're pretty much done with vital signs at that point, and you're calling lights and sirens, trying to get them to the emergency room right away. But if someone comes in and it's not clear what it is, so they have some of the symptoms, but it's not clear, then I would ask more questions and continue my exam to try to make more sense of what's going on. And then one brings up a good point. Would you take vital signs first and then ask questions? Usually we start with our history before we get into our physical exam. So technically you'd probably start verbal before you did vitals, but I'd make a good argument you could do both, that you could monitor vital signs at the same time that you're quizzing the patient. See, Clydell, how do we review the past sessions if we miss it? So if you're part of the class, I post all of the sessions so you can access them as you wish as a part of our class. All right, let me go ahead and I was going to post the link. Those of you who are interested in joining the class, we're starting up on Monday. We're going to do musculoskeletal first. So musculoskeletal, going to spend a long time, well, 4 sessions through next week talking about the musculoskeletal system, all through examination, differential diagnosis, intervention, and then practice questions. All right, so there's the link to the class, those of you interested in jumping into the class. And then Bridget asks a good question. Do you recommend this class 6 months prior to our exam? Yes. So we go through the content. Those of you who are targeting the April exam, especially if you want to go through the material at not so speedy of a pace, it would be great to start right now, because we'll go through all of the systems and then we'll go through them again in February. And I like to freshen up my lectures. I try to make them specific to the people who are there listening. And so therefore, if you're targeting the exam farther down the road, you get a full 9 months of access to the content. So you'll have access to the content, and it'd be a good 6 or 9 month study plan. So Gabrielle asking a question about the early bird. So for the crash course, it is just a couple of sessions each week. So it's really meant to be just the basics from the big 3 systems. So you can use the code EARLYBIRD to get the PT or PTA crash course. If you go to ptfinalexam.com and click on all courses, you'll be able to see it easy. But yeah, so it's meant to be, you get about 12 hours of content. And it's all about the most pertinent content right before exam day. And so it's very much a crash course. We go through things very, very quickly. And I don't want to, like, I got some feedback this quarter. It was kind of funny. I got some feedback this last quarter about the crash course, that it was good content, but they felt like it was very fast. It is fast. It's meant to be as many topics as we can pack in very quickly, just to remind you of them for test day. Whereas with our live course, this is where we slow down and actually talk about the content in more depth. We help you understand it, versus just the crash course, which goes through it very, very quickly and is a good reminder. But the full live course, that's a better fit for those who need a little more content, a little more time. Let's see, Andy asks, Will, do you have a specific strategy when it comes to how to approach the questions? So I've heard 1, focus on the entire header, ignore the answers, or 2, focus on the last part of the header, meaning the questions. Last one is cover the question and read the answers first. All right, so Andy, great questions. And there's a time for a couple of those. So I'm going to divide it into our regular questions. So regular text questions. Let's see, regular questions. This is where I apply the read. You look at the content of the question. You look for the key information, and then you make sure you're answering the right STEM, answering it correctly, and then look at the options. For picture or image questions, the key to analyzing an image question is to step number one is look at the options. Answer options. And then 2, review the image or look at image. So that's the only time I'd have you cover the question, so to speak. If you know it's an image, you see the image, don't bother analyzing the image until you've looked at the options, and then you can look back at the image and see what it is you're looking for in the image. Yeah, generally I don't say to read the question backwards. I've heard some people try to do that where you read the options and then the answer and then the question. My brain just doesn't work that way. I know that some people like that, but I'm just I guess I like reading the question so I know what I'm looking for, and then look for that. You formulate an answer in your own mind and then look for that among the answer options. See, from an earlier slide, when you're talking about the longest option, were you saying it's most likely the answer, the one that you could eliminate? Usually the lengthiest answer option is the most correct just because it has more detail in it. Now, remember, I said usually, and it's not necessarily, it's just something to pay more attention to. Let's see, is there a deadline to sign up for the early bird crash course? Yes, you have to use the early bird before the first day of class. And so we're starting up our PTA class on December 7th, and we're starting up our PT class on January 4th. So you just have to sign up before then to use the early bird code. See, Carolina asks, is it recorded just in case you miss a class in the crash course? Yes. Yes, I record everything, post it, both in the full live course and in the crash courses. So Isaac asks, hi, Will, what strategy would you suggest for questions that have 4 answer choices that are all numbers? Would you say eliminate extremes always, or any other idea? Good question. So when you're looking at number questions, so let's say the question is asking about a person has, let's say they have an active infection. They've got pneumonia, an active infection. What would their white blood cells look like? 0 to 4, 4 to 10, 10 to 20, or just something like that. You can't automatically eliminate the higher end or the lower end, because the lower end would be a case, someone with, let's say they have leukemia, they'd have a decreased white blood cell count. Between 4 and 10 is the normal white blood cell count. And then above 10 is an abnormal or elevated white blood cell count. So I wish I could give you a hard and fast rule about numbers. There's just not one. There's just not a hard and fast rule. So again, I wish I had a quick fix for numeric type questions, but you just have to look at it and analyze it based on what's given to you. So for instance, if you know that it's an infection and you know white blood cells are higher, then you could eliminate the lower options and that would leave you with the higher options. Let's see, when are the startup dates for the PT crash course? So we haven't started our full push into the PT crash course yet, you guys. Let me go ahead and post it here. I'll put the link in the chat box so you guys can see this. So yeah, we just barely are getting things going. We're still about, I guess, almost 2 months away from starting. Well, yeah, less than 2 months away from starting our PT crash course. The PT exam for January is on January 26th. And so we'll start right after the new year. Let's see. So here is the crash course for PTs, if you want access to that. And just enter the code earlybird. Let's see, Aman asks, do you recommend the course for someone who is a little more than a year away? A year away from taking the test? It depends. Depends on, if you're ready to start now, then it would certainly be a good option to really jumpstart the whole process. Would absolutely be recommended. That what happens so often is that when people are preparing for a test, they go on mental vacation until about 6 weeks before test day, when really they should be using all this great time they have, because unfortunately for us as humans, we tend, the more time we have, the more time we waste. So important to get started. See, Cassie, hey, Will, do we have flexible dates for January 2021? Yes. So I talked about this on Tuesday, but COVID has affected Prometric, meaning that they have fewer seats available in the Prometric Testing Center. And so therefore, the test window, I believe, goes from January 26th until February 9th. It's a 2-week test window in January, which is different. We've been in about 6-week test windows, 5 or 6 week test windows, and they're reducing that for January to 2-week test window. And then I anticipate probably by April, or again, this is prognosticating, but by April or July, they'll probably have this thing figured out enough so that the fixed dates will come back in. Maybe they'll have a 2-day test window instead of a 2-week test window. Nice. Very, very good questions. Now we can talk about more of your questions. Let's go ahead and dive into our first practice question. So here's your first practice question. I'm going to open up the poll. All right, so you should see a poll. Please click in your answer. Click in your answer, and then we'll talk about it. Talk about the content. So ready, set, and go. I'll be quiet for 72 seconds while you answer this question. All right, about 10 more seconds. 10 more seconds. And time. So this is a question that's all about whether you know your nerve injuries or not. A patient who has suffered a traumatic blow to the posterior knee begins to exhibit signs of tibial nerve dysfunction. Which of the following impairments will most likely be present with a tibial nerve injury at the level of the popliteal fossa? So level of the popliteal fossa is important because the sciatic nerve divides into common peroneal and tibial above the popliteal fossa. So at popliteal, we're at an isolated tibial nerve injury. And so therefore, the most correct answer, we know the tibial nerve innervates the plantar flexors. And so they would have difficulty with plantar flexion or have weak plantar flexors, which would also alter sensation on the plantar nerves that go on the plantar surface of the foot, especially on the heel. The sural nerve is also a branch of the tibial nerve, and it gets more of the lateral malleolus. I remember there's an L in sural, lateral malleolus, and we'll talk about this in our class as well, going through all the nerves and dermatomes and myotomes. But in this case, we're talking about weak plantar flexors related to the loss of the tibial nerve. And so here's your trick question. If you're ready for your trick question, will the tibial nerve injury result in a steppage gait pattern? So here's your follow-up quiz question. Will the tibial nerve injury that we've described at the level of the popliteal fossa, will a tibial nerve injury result in a steppage gait pattern? So will it result in a steppage gait pattern? Oh, good. You guys are too good. Usually I can trick people with that one. So the steppage gait pattern is related to dorsiflexors. So weak dorsiflexors, which, follow-up question, what nerve innervates tibialis anterior and is heavily involved in dorsiflexion? Dorsiflexors are innervated by the deep peroneal, right? So you would only have a steppage gait pattern with a deep peroneal nerve injury or a dorsiflexion weakness. That's clear, right? So that deep peroneal nerve would result in weak ankle dorsiflexion and would result in the steppage gait pattern. So then your final follow-up question, tibial nerve injury, what gait deviation would show up? For a tibial nerve injury, what would it look like? Someone who could not plantar flex. Someone who has difficulty plantar flexing. So someone who can't plantar flex, they have weakness in the plantar flexors. Daria, exactly. The push-off will be very weak. So you can't advance your limb forward or advance yourself forward because of the weak plantar flexors. And so therefore, you'd have a shortened contralateral step. Short contralateral step. Because as you're trying to advance yourself forward, so during the push-off phase of gait, so as you're trying to advance your body weight forward with your plantar flexors, if you don't have good plantar flexors, it means you can't push yourself forward. And so therefore the contralateral foot comes down early and you get a short step. Shortened contralateral step from that weak push-up. All right, so I keep saying final follow-up question, but the final follow-up question is this is the contralateral step length. So you get a shortened contralateral step. What would be the effect on the ipsilateral step? So let's say that this is our right foot. What would the ipsilateral step length be? So if we know the contralateral step length would be short, what would the ipsilateral step length look like? That would just be normal. There's nothing wrong with the swing phase. You'd be able, your hip flexors are working fine, your dorsiflexors are working fine, everything works fine. You'd just be able to go out and put your foot down, no problem. So it'd be normal. However, Shreya, you bring up a very good point that in contrast, you'd have a shortened contralateral step, which means that the ipsilateral step would appear, it would be greater in length, but only because it's normal and the contralateral step is shortened. Did I make any sense saying that? All right, any questions about this, what we've been talking about? Any questions or concerns as we continue on? So Rosa asks, how many hours of studying do you recommend for someone who is studying 3 months in advance? So for a 3-month study plan, I typically recommend 4 to 6 hours, or sorry, somewhere around 4 hours most days. So 2 to 4 hours of good quality study time most days, maybe a few days, a little more, a little less, but it should be 2 to 4 hours most days. All right, let us go on to our next question here. So let's do this. Next question. I'm going to open up the poll box. All right, 72 seconds. I will be quiet while you answer this. Ready, set, and go. All right, about 10 more seconds. 10 more seconds. All right, and time. So this one, another good one about mobilizations. So if you knew that it was a dorsal or a plantar glide, then that would give you an idea of which, you can narrow it down to two, and then trying to decide between those two, which one would be most correct. So this one, most of you got this one right too. Patient is noted to have limited great toe extension during the terminal stance phase of gait. So you know that during terminal stance, you require a great deal of great toe extension in order to increase the first MTP joint extension, so your big toe. In order to go through full extension, which joint mobilization would be most appropriate? So the correct answer is a dorsal glide to improve first MTP joint extension. So if you were to look at the first MTP joint, so the big toe, you would see that the distal end of the metatarsal is convex, sitting on a concave, the concave proximal phalanx is sitting on the metatarsal head, or the convex metatarsal head. So therefore, the convex concave rules apply. Because it's a concavity, you move in the same direction. I remember there's an A in concave and same. And so therefore, to move into great toe extension, you need to glide in the same direction. So glide dorsally in order to achieve full great toe extension. And the way I remember this, if on the test you forget what the anatomy of the first MTP joints and MCP joints look like, as I hold up my fist and I look at the round knuckles, your knuckles, those are the heads of the metacarpals. In this case, we're talking about metacarpals. And you can see that it's a nice convex surface. And so the phalanx is sitting on that nice convex surface. So that's how I remember. It's the same for the foot. Just remember, if you can make a fist on the test and look at those rounded metacarpal heads, it is the same down in the feet with the metatarsals. Nice, nice. Very, very good. Let's see. So Rosa asking question, do you recommend taking a day off once a week? So I do recommend this. Good day off, just to pause, regenerate. I like to have a holistic view of studying, meaning that you don't just spend 12 hours every day, because honestly, very little of that time will be effective. I like to spend more of my effective time looking through the content, and then taking the time when I feel less effective, take a little break and come back to it. And then generally taking a day off, or a couple of half days. I don't know. You can work it how you wish, but it's important to have a good holistic approach to studying. Let's see. And Sotonye asking a question. I'm not 100% sure the context. Maybe you could ask that one just a little bit more detail there. How many then for 2 months? About the same. Yeah, we'll try that one again. So I've got one more practice question for you. So I'm going to stop that. We're going to go to the next. This is our final practice question, and then we'll finish up for today. So here you go. 72 seconds. I'll be quiet while you answer this. Ready, set, and go. All right, about 10 more seconds. 10 more seconds. All right, and time. So most of you got this one right, which is fabulous. Patient presents to physical therapy with the following weaknesses in the right upper extremity. You've got flexor pollicis longus, 2 out of 5. Pronator teres, 2 out of 5. Pronator quadratus, 2 out of 5. So we've got the pronators and flexor pollicis longus, as well as the lateral 2 lumbricals. So remember, in anatomical position, the lateral 2 lumbricals are towards the radial side or towards the thumb side. Whereas the medial 2 lumbricals are 5 out of 5, and extensor digitorum is also 5 out of 5. So which of these is the most correct answer? Where the median nerve is what innervates these guys: flexor pollicis longus, pronator teres, pronator quadratus, and the lateral 2 lumbricals. All of these are innervated by the median nerve. Specifically, the anterior interosseous nerve hits that flexor pollicis longus. Anterior interosseous is just a branch of the median nerve. Posterior interosseous branch, this one innervates the extensor carpi radialis brevis and the extensor digitorum. It is a branch of the radial nerve. So radial and posterior interosseous, these are pretty much the same answer, just because posterior interosseous is a branch of radial. And then the ulnar nerve innervates the flexor carpi ulnaris, the medial half, or the pinky side towards the ulnar side of flexor digitorum superficialis and profundus, the medial 2 lumbricals, as well as adductor pollicis. Also innervates all of the interossei. So median nerve, most correct answer here. And this is one where you get, these ones are so tough because you get the information, and if you don't know that the median nerve innervates those, it makes it really, really hard to just guess it. But if you knew that posterior interosseous and radial are the same, or the posterior interosseous is a branch of radial, you could have eliminated number 2 and number 3, which leaves you with number 4 and number 1. And then the key here is that the lateral and medial 2 lumbricals, you'd be able to at least say, okay, median. Well, I know the ulnar nerve is on the medial 2 lumbricals. Ulnar nerve hits the 4th and 5th digits. And so you could have ruled it out and gotten down to median versus ulnar, but then the correct answer is the median nerve. Nice. So what questions do you have? We've been going for about an hour now. This whole last year, we've been getting more and more 800s. Like I just talked to a student yesterday who got a 781 on, he just took our class and got a 781. I've had a couple getting 800s over the summer. So we help people really get ready for the content of the exam. I like to use our workbook. We have a workbook that goes through the content that's extremely beneficial to stay organized. And that's the key when you're studying, is just to consistently work each day through the content, making sure that you're not just seeing it, but you're also mastering that content. Let's see. So Tonya asking, how many hours then do you recommend for studying if the test is 2 months out? Then about 2 to 4 hours then. So if your test is 2 months away, which, I mean, the January test is on January 26th, so we're about 10 weeks away. But if your test is 2 months out, you might need to bump up the time. It just depends on how fresh you are in the content. So maybe lifting that limit from 2 to 4 to 4 to 6, just because you have less time. But at the same time, more time doesn't necessarily mean better time. So really good quality time can be, you don't have to have as much if it's good quality. Let's see, another question over in the Q&A box about, how about questions that involve manual muscle tests, such as spinal cord injuries or CVA patients? Although their manual muscle tests are high, there is still suggested specific assistive device. What do you suggest? Ooh, good question. It just depends on the case. Like we'll talk about that in our neuro sessions. We'll talk a lot about assistive devices and manual muscle testing for spinal cord injuries, especially because that's how you determine what the level of the spinal cord injury is. So I'm not sure I have a great short answer on that. Yeah, so Tonya, so if you're fresh with the concepts, then probably 4 hours most days would be a good fit. See, Rosa, how much is your neuro course? So I don't have a just neuro course. I've got the crash course, which you can get on the discount, or you can take a part of our full live course, which includes the neuro. I don't have just a neuro tidbit. Although I guess if you wanted to send me a quick email, and I might have something that could fit, just depends. Let's see, G asking, I feel I understand what contents would be in the NPTE. In this case, what course would be good for me? Any recommendations? I feel like I understand the contents would be the NPTE. Probably then the crash course. The crash course is a good way to just review what's going to be on the test very quickly right before test day. So crash course is good for quick review. If you don't need to ask questions, if you just need to see the content, crash course or our independent study course, both of those are good. But if you have questions or you need coaching through the content, that's where the live course really comes in handy. Or if you need to boost your scores. So typically people who take our class boost their score between 50 to 100 points most of the time. I've had some people increase about 160, 170 points from one attempt to another. And then obviously we've been getting some people some perfect scores lately. Let's see, did Andy asking, do you know a tip where to find practice questions? So practice questions, we have now 3 full practice exams on PT final exams. So that's a great place to start. $99 will get you our exam simulator plus 3 full practice exams. The PETs are also fabulous questions. Therapy Ed and Score Builders both have great sets of questions. And then there's a few more as well. So there's lots of questions available. Yeah, lots of questions, but definitely PETs should be very high on the list. See, Kaylee asks, what would be a good course to take for PTAs who take the exam in January? Is there a PTA specific crash course? Yes, Kaylee. So we are starting up our PTA crash course on December 7th. Let me go ahead and grab that link real quick. So yes, we will have a PTA specific crash course for those of you who are targeting the PTA exam. Let me go ahead and get you the link for that. I'll post that in the chat box right here. And the other way to find it is if you go to ptfinalexam.com and click on courses, or up at the top, you'll see all courses and you'll be able to see the PTA crash course as well. Nice. Let's see, Bridget, you have a study guide and workbook you use? Yes. So I've got an original study guide and workbook that are included in our course. When does the live course start? We're starting on Monday. Start on 11/16. We'll be going through the musculoskeletal system. I'm excited. We're going to go through a lot of really good content. I'm teaming up with another PT and we're making even more and better content. So those of you who are already a part of it, you're going to reap the benefits there. And those of you who are about to join, you're going to get the best course yet. Adding more and more content, more practice questions. We just had our 3rd exam simulator. I mean, this thing, we are on a roll over here trying to develop lots of good content for you. And like I said, we're going to getting people more and more high scores, 780s, 790s, even a good handful of 800s. Let's see. Raul asks, how long before the exam do you recommend to take the PET and the retired exam? So on the PET, let's see, I think you get 60-day access to the PET. And so therefore, about 2 months before exam day is a good time to get that PET. Gives you time to go through it and review it. So Bridget asks, what's the schedule again? So for the full live course, we go on Monday, Wednesday, Thursday at 5 p.m. Eastern, and then Saturday at 9 a.m. Eastern. These are Eastern times. So Monday, Wednesday, Thursday, 5, and then Saturday at 9. Usually our sessions last about 90 minutes long. It just depends on questions. Sometimes we go a little longer. I found that people tend to start zoning out after two and a half hours of content. Like this last quarter, we did one that was, I think we did a solid 2.5 hours. And I couldn't see people's eyes glazed over, but it felt like their fingers were glazing over. So I try to keep things to about 90 minutes and we do it more frequently so we can go through the content. See, Mavinder asks, what is the retired exam? So if you purchase the PETs, one of the PET exams, the practice examination and assessment tools, one of the PETs, when you purchase the PET from FSBPT, one of them is a practice form and one of them is a retired form, meaning that people actually got their license from the retired form. So that's available from FSBPT, the PET exams. Let's see, Kaylee asks, I see under PT final exam that there are PT exams. However, besides the PET, are there any other exams for PTAs besides inside exams and online advantage? So at PT final exam, I have one PTA exam and I'm planning on, we're in the works. I think by December, we'll have our second PTA exam available. Right now we have 3 PTs and 1 PTA available. And those of you who will be a part of the crash course the PTA crash course, you'll get early access to those PTA exams. See, is there a discount for the January PTA crash course? I love that it's the crash course. So when I was first creating the crash course, I accidentally typed one time. I was typing it just in some of the drafts and it came out as crush course. I'm like, yeah, that's a good way to call it. So this is our crush course to get you ready to crush the exam. So if you put in the code early bird for the crash courses, this is for the crash courses only. Oh shoot, and I've got October there. We are not in October. Sorry, team. It is for the January exam. January 2021 crash courses. Use the code early bird and you can get that price reduced. And again, that's for the crash courses. So Bridget, how many weeks does the live PT course run? Great question. So we're starting up the full live course. We're starting it up on 11/16. Oh, and by the way, PTAs are invited into our full course as well. We time it, and we talk mostly about PT content, but I've had many PTAs take it and enjoy the content. They enjoy the depth of the content and they enjoy the one-on-one interaction because we can talk about things like this last time around. I had a student who she'd passed or graduated from school 5 years ahead of time and then had not taken the test for 5 years. So we had to redo all the content and we spent a lot of time on the phone going through content and she was able to pass on her first time back. So PTA is a really good fit as well. But we'll go from 11/16 all the way till 1/26. So it'll be a full 10 weeks. The holiday weeks, I've got things a little bit more flexible because I know people will be either traveling or have family commitments. So holiday weeks, especially New Year's, Thanksgiving, and Christmas, we'll have some slightly varying schedules, but we'll go for 10 weeks from 11/16 till 1/26 on the Monday, Wednesday, Friday, Saturday schedule. And I've got a few bonus things coming up as well. And those of you who purchased this one, we're about to roll out our 4th full practice exam in our exam simulator. So you'll get early access to that as well. So you get 4 full practice exams. We're really close. The 4th one isn't published quite yet, but we should be really close to number 4 really soon. Nice. What other questions do you guys have? Any other questions or concerns? So when does the crash course start? So for PTs, we're starting on January 4th. January 4th. Let me just double check. It's that first Monday. Let me go here, check the calendar. But our first Monday, we're just getting all geared up for that one. Yeah, January 4th is for our PT, and then PTA, we're starting up in December on December 7th. Those are for the crash courses. I see Kaylee ask, I know I may have missed this, but what's the code? You can enter the code earlybird to get a discount. Oh, shoot, I've got 9-1. Yeah, so the code ends on the first day of class. So be sure to use that early bird code before. And Bridget said, 10 weeks you said, plus we get the crash course. Yes, so for the full live course, you'll get access to all of this, plus access to our crash courses, plus access to our video modules. You get everything. In this one, it is the whole enchilada. There's nothing you don't get when it comes to the content. I see Bobby asked, do you know if they updated the PEAT recently? So in the summer, in June of 2020, they updated the PEAT, and now there are 2 versions of the PEATs. Remember, the PEATs come in pairs. So you have 2 pairs of PEATs. There's a lot of P's there. 2 pairs of PEATs. And so if you already purchased one set of PEATs, if you go to purchase again, it'll automatically give you the other set of PEATs. So that was the most recent, and I don't think they'll change PEATs again until 2022. Yeah, they usually change them about every 2 years. So I think we'll be up for another change in 2022. Cool. Any other questions? Questions or concerns? As always, you can reach out to me. You can reply to any of the emails you've gotten from me, admin@ptfinalexam.com, or you can go to ptfinalexam.com/contact, or you can go over to Facebook, NPTE Resources Facebook page, totally free group where I post the recordings and links to these sessions. Yeah. Also be sure to check out the podcast. Like I said, free podcast called the NPTE Podcast. Really good fit for runs or drives. We try to go, and I just published a PTA episode, so be sure to download if you're interested in the PTA exam. I just did a PTA episode as well. Cool. Well, thank you so much, guys. Really appreciate you spending the time with me. And as always, have a fabulous day. Hope to see you in the class. We're starting up on Monday. And in the meantime, study well. Good luck on the test. Will Crane fist bumps all around. Have a great day, everyone.